Hi, this is obviously a trying time in so many ways, and it is completely normal for you to be feeling a bit concerned, a bit anxious, as new steps are introduced to stop the spread of COVID-19. Looking after your mental health, along with that of friends and family, is a really important part of staying well. And look, we've certainly had a focus on general health, but mental health is a massive part of that overall well-being. The good news is there's a great range of high-quality services that you can access free from your home. Camilla Kenny is based in Dubbo but serves the Western New South Wales Local Health District, and she's here via Skype today. G'day, Camilla.
Hey, Dougal, thanks for having me.
Look, thank you so much for coming on board to have a chat today. In very simple terms, from your perspective, what are some of the things that are important for people to be thinking about and doing right now?
So I guess it's really important to be taking all of the safety precautions that we're hearing throughout the media and through the New South Wales and national government websites. But I guess in terms of looking after our mental health, there's some really crucial things we need to be doing. And I think social connection is one of the biggest ones. We've seen social connection be highlighted over the last few months and years throughout the drought and also the bushfires. And the way we've done that is getting people together into gatherings and barbecues and events. And at the moment, that's not really possible. So we need to be a bit more innovative about how we can actually connect with one another, additional to the other things we can do for our mental health, like sleeping enough, eating well, exercising, and all of those great things we can do.
And why do you think now is a good time to be sharing some of that information? I suppose timing can be everything in a situation like this. Why is now a good time?
Now's a great time to be sharing this information because we can try to get on top of it early and build these skills really early and act in an early intervention sort of phase, rather than everyone becoming really, really overwhelmed and potentially mentally unwell and needing services. There are lots of things we can do to stay well and stay on track so we don't actually have to go downhill. It's also a great way to actually build our skills and our resources with the people around us, both physically and virtually, so that we can all be looking out for one another. So if there is someone who's struggling, we can recognise it and help to link them into services.
You mentioned the distancing, and look, we're moving more towards trying to say keep your physical distance but maintain your social connections, and that's one of your big messages. So that's again, it's about being innovative, but you can still have fun online.
Absolutely. I think it's really important that we're physically distancing ourselves but staying socially connected. And I did a great webinar that Mrs. Christine Morgan was part of from the National Mental Health Commission, and she really drove this home yesterday, and she was talking about the need to be proactive, creative and committed to social connection. So really looking at, we talk about let's have a Skype meeting or let's have a Zoom meeting, but booking it in and actually doing it, with someone. There's plenty of people who are encouraging this, but they're not actually acting on it. So we really need to act on it. Also looking at the other ways we can connect with other people who may not have access to technology. So whether it's, having a phone call with someone who's elderly or outside of our family who can't access technology, or even writing them a letter. We still do have the post as well. So, looking at some other innovative ways that we can actually connect with other people.
So what are some of the simple resources that we can access from our homes?
There are plenty of resources out there, and if you start Googling mental health or support, you will probably get inundated. So there's a couple of really key places you can access information and support. A great one is the federal government website called Head to Health, and it's a digital gateway for mental health information and support services as a bit of a starting point. Our website, RAMHP, also has a dedicated page now to the COVID-19 supports and information, but also lots of other information for rural communities specifically on how we can access our services and how we can look out for one another. There's still the usual phone services like Lifeline, Men's Line, Suicide Callback Service, etc., that are all phenomenal and there to support us as well. So lots of support available to our communities, even if we can't access it face-to-face at this time.
Some really good messages. This is something anyone can do. It's a simple setting up a Skype or a Zoom meeting, whatever it needs to be. You can still stay in touch. Thank you so much for joining us.
Not a problem at all. Thanks so much for having me, and I hope everyone can really stay connected.
That's Camilla Kenny from RAMHP. And to see a full list of all of the services that you might be able to access from your place, check out this post and stay well.